President Trump wants to love and cherish Medicare and Medicaid, because he believes every American should get the care they want, need, and deserve.
But what I want to know, yes or no, is since you cherish Medicaid, will you agree to oppose cuts in the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, doctor.
How many children losing health insurance would be acceptable to you?
I don't want children losing health insurance.
Well, then you're going to need to reject the Republican budget plan.
Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
Senator, it's one of many approaches I want to use.
I appreciate it. I thought you might say yes a second time, but it's not yes or no. So
You might recognize them. They're sitting behind me, this whole slew behind. A healthcare cost per person in this country is twice that of other developed nations. So it's not just about the money. We're already putting twice as much money into the system. Why is it costing us so much? Because of chronic disease. And those chronic diseases, and we made it easy to be sick in America, are linked to poor lifestyle choices, and they drive 3/4 of the $1.7 trillion that CMS spends a year to support Americans' health. As a heart surgeon, I can attest that the most expensive care we give is bad care. You pay to do the wrong thing, you pay to fix what was done wrong, then you pay to deal with all the complications. It's immoral, it's wrong, and it's expensive. We have a generational opportunity to fix our healthcare system and help people stay healthy for longer. That's why President Trump wants to love and cherish Medicare and Medicaid, because he believes every American should get the care they want, need, and deserve. Now, to achieve this mission, CMS should work with Congress to find efficiencies that can help stabilize our insurance markets, which will make it easier and more affordable for Americans to adopt healthy lifestyles.
But what I want to know, yes or no, is since you cherish Medicaid, will you agree to oppose cuts in the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, Doctor. The question is, will you oppose cuts to this program you say you cherish? Time's short.
I want to make sure that the patients today and in the future have resources to protect them if they get ill. The way you protect Medicaid is by making sure that it's viable at every level, which includes having enough practitioners to afford the services, paying them enough to do what you request of them, and making sure that patients are able to actually use Medicaid.
Let the record show that I asked a witness who said he cherishes this program, will you agree to oppose cuts? And he would not answer a yes or no question. Let me ask.
People, President Trump has been very clear on this, want to reduce the cost of medications to our government and to the American people, the copay. That's not happening right now. We can do better. And the PBMs are one way of affecting that change.
Do you support the Republican budget plan that terminates the health coverage of millions of Americans, including as many as 30,000 children in my state?
Senator Hazard, I've not seen the details of a House bill that says that. I look forward to examining it with great care, confirmed by this.
So let me ask it another way. How many children losing health insurance would be acceptable to you?
I don't want children losing health insurance.
Well, then you're going to need to reject the Republican budget plan.
Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
I'm going to look, as the president has instructed me to already, for every single way that we can reduce drug prices. And there are lots of options available. I feel compelled to pursue every one of them.
I'll ask you one more time, because I think I heard it, but I'll give you another chance. Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
Senator, it's one of many approaches I want to use.
I appreciate it. I thought you might say yes a second time, but it's not yes or no. So from you, that's fine.
The answer to me is I am in favor of work requirements, and I don't believe we should allow.
Do you think a family should have to fill out paperwork every month just to get health care?
I don't think you need to use paperwork to prove work requirement, and I don't think that should be used as an obstacle, a disingenuous effort to block people from getting on Medicaid.
HHS Inspector General found that in 2022 alone, United Health used these home visits to add about $2.3 billion worth of diagnoses that led to absolutely no treatment. And I take it you think that sounds like fraud as well.
We are, I think, as an agency, aware of this. I haven't been in there yet, but if confirmed, this will be one of the topics that is relatively enjoyable to go after, because I think we have bipartisan support.
I love hearing this. So upcoding is a scandal.
The Finance Committee stands adjourned.